the CDC is advising the use of non-medical cloth face covering as an additional voluntary public health measure. So it's voluntary. You don't have to do it. They suggest it for a period of time, but this is voluntary. I don't think I'm going to be doing it. We've already leveraged the DPA to stop the hoarding and price gouging of crucial supplies. Under that authority, this week, the Department of Health and Human Services, working with the Department of Justice, took custody of nearly 200,000 N95 respirators, 130,000 surgical masks, 600,000 gloves, as well as bottles, many, many, many bottles, and disinfectant sprays that were being hoarded. All of this material is now being given to healthcare workers. Most of it's already been given out. As we deploy the power of our military, we're also deploying the skill of our doctors, scientists, and medical researchers. We continue to study the effectiveness of hydroxychloroquine and other therapies in the treatment and prevention of the virus, and we will keep the American people fully informed on our findings. Hydroxychloroquine, I don't know, it's looking like it's having some good results. I hope that would be a phenomenal thing, but we have it right now. In approximately now, it's increased to 1,500 people.
The CARES Act, signed by the President, includes another $100 billion for healthcare providers. Under the President's direction, we will use a portion of that funding to cover providers' costs of delivering COVID-19 care for the uninsured, sending the money to providers through the same mechanism used for testing. As a condition of receiving funds under this program, providers will be forbidden from balance billing the uninsured for the cost of their care. Providers will be reimbursed at Medicare rates.
I'm feeling good. I just don't want to be doing, I don't know, somehow sitting in the Oval Office behind that beautiful Resolute desk, the great Resolute desk, I think wearing a face mask as I greet presidents, prime ministers, dictators, kings, queens. I don't know. Somehow, I don't see it for myself. I just maybe I'll change my mind.
The CDC, the World Health Organization, my office, and most public health and health organizations and professionals originally recommended against the general public wearing masks because based on the best evidence available at the time, it was not deemed that that would have a significant impact on whether or not a healthy person wearing a mask would contract COVID-19. We have always recommended that symptomatic people wear a mask because if you're coughing, if you have a fever, if you're symptomatic, you could transmit disease to other people. What has changed in our recommendation? Well, it's important to know that we now know from recent studies that a significant portion of individuals with coronavirus lack symptoms. They're what we call asymptomatic. And that even those who eventually become pre-symptomatic, meaning that they will develop symptoms in the future, can transmit the virus to others before they show symptoms. This means that the virus can spread between people interacting in close proximity. For example, coughing, speaking, or sneezing, even if those people were not exhibiting symptoms. In light of this new evidence, CDC recommends and the task force recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain.
Why is it we don't have enough masks? Why is it we don't have enough medical equipment in this country?
Previous administrations gave us very little ammunition for the military and very little shelf space. Let me just tell you, you know it. You know the answer. The previous administration, the shelves were empty. The shelves were empty. So what you should do is speak to the people from the previous administration, Jim, and ask them that question, because the shelves were empty. And there is a problem where, and which I pointed out, I said you shouldn't do it this way, with unemployment, where 40-year-old equipment by the states, we're sending the money to the states. Once the money is sent to the states, then the states, whether they're Republican or Democrat, have to get the money out to the people. Hopefully they will be able to do it. But many of those states have 40-year-old computers. I don't know that they're equipped. I wanted to give the money direct, if that's what you're talking about. I wanted to give the money out direct. It would have been much easier. But the Democrats and some people said, no, let's do it the complicated way.
The antibody piece is critical, as you described, because at this time, we can't, if we have, let's say asymptomatic status is inversely related to age. And so the younger you are, the more likely you are to be asymptomatic. We have to know that because we have to know how many people have actually become infected. So when we talked about 5 days ago, I think on Monday, I called on universities to work on an ELISA-based test to test for their health workers and really get through that. At the same time, the private sector is working on tests. And what do we want those tests to be? We want those tests to be like what we use for HIV and malaria. Finger prick onto a cassette, you get a line if you're positive, and you get a control line. Negative, the line isn't there, and there's the control line. That's our dream assay because it's a finger prick.
And where is Dr. Fauci?
I don't know, but every time you ask that question, whenever he's not here, you look, you say, where is he? And you'll say, is there a problem? No problem whatsoever. Every time he's not here, sometimes I'll ask him to come because that's the first question that you and a couple of others from the fake news establishment ask is, where's Dr. Fauci? We're doing great together.